All right, so exploring and defining radical belonging. According to Webster's dictionary, radical could either mean very different from usual or traditional, or it can mean favoring extreme changes in existing views, habits, conditions, and institutions. And belonging is defined as close or intimate relationships. So our team definition, we have two. One is radical belonging in healthcare means bridging the gap between healthcare professionals and patients to work closely together to advocate for change in traditional healthcare practices. And the second is creating a safe space for those who are in acceptance to dramatically changing existing views, habits, and conditions in healthcare. There are two articles, Lit Review, and one is according to the Radical Change in Healthcare organization, they stated radical belonging requires attention to power dynamics, persistent leadership, elimination of boundaries between collaborating groups, and aligning incentives with desired practice changes, and attending to both variances in processes and understanding healthcare change. In the second article, the Toward Radical Belonging article proposes that there are three essential interconnected aspects of radical belonging, social belonging, or an ethos of critical care, cultural and linguistical, responsive, collaborative, and anti-hierarchy and thematic belonging. Next slide.
Okay, so now we're going to be looking at the importance of radical belonging to the healthcare team. Summarizing from what we read, this includes denial of racism, discrimination, and prejudice in healthcare and education, as that's the most harmful thing to progress. These attitudes and behaviors need to be recognized in healthcare and education and identified in order to work for a more equitable future for all. The success of radical belonging has to be a collective effort. It's not something any one individual should be left responsible for. And then this was just a quote I thought summarized everything really well, that radical belonging is the interweaving of the diverse knowledges, strengths, goals, and needs that different members of the community bring. So why belonging is important to the healthcare team. Not belonging can actually be detrimental to an individual's health and well-being, and it's important to ensure the healthiest healthcare system in being effective providers. I've been told you can only take care of patients and make them healthy if you're healthy, but we have to make each other healthy also. The belonging felt by each individual is dependent on others because humanity is so interconnected. It's not just a solitary task or goal an individual can work on. And then radical belonging is never something that will be over, have a final conclusion. Belonging with others, though, can provide momentum. So it starts with little steps that get bigger and bigger. So change can actually be seen for the different team members' experiences.
So how can we support radical belonging at M Health Fairview? First, I would like to take a look at the few of the team members' experiences from the case. Jessie, an aide at a nursing home, used to find satisfaction and passion in her job by developing deep relationships with her patients. Her supervisor thinks that this involvement makes her unprofessional and inefficient. Kadra, a family medicine physician, feels exhausted by the increasing workload due to the pandemic and has had to give up what she enjoyed most about medicine, which is seeing patients and building personal relationships with them. Sarah, a registered nurse, is frequently forced to make decisions between being on time and present for her job or being there for her two children as a single mother when they need her. Rather than an empathetic response, her supervisor scolds Sarah for being 10 minutes late to her station. These experiences highlight a common theme, that there are policies and expectations in place that emphasize individualism over collectivism, an ideal which many communities of color prioritize. This may be engendering an environment of unbelonging, and by identifying and transforming these policies, we can support radical belonging at the organizational level. I'd like to look at some other experiences of the team. Jessie often experiences insensitive, racist, and homophobic remarks from coworkers and patients, making her feel isolated and exhausted. She hopes for a future where employees have somewhere to turn to address microaggressions and discrimination without fear of repercussion. Because of the attitudes and opinions of some of her patients and team members regarding certain social and political matters, Kadra no longer feels safe sharing her beliefs and opinions with them. What can we do on both the team and individual level to support Jesse, Kadra, and other members of the team with similar experiences? We can acknowledge that staff and patients are experiencing racism and prejudice both in and out of the hospital and create opportunities for processing these experiences, questioning the systems and policies that enable these experiences, explore potential actions to take, and engage in collective healing. There are two more experiences I want to discuss. Andrea, a healthcare administrator, is experiencing burnout and exhaustion due to the immense workload of conflicts that need to be resolved that the pandemic has brought on. Jonas feels unappreciated by his coworkers despite performing an essential role in sanitizing equipment in hospital rooms. This pushes him to question if he should transfer to a different hospital for better pay. At an organizational level, we can support radical belonging in these cases by developing a system that allows for all staff, from environmental services workers like Jonas to physicians like Kadra, to participate in decision-making as partners with full rights and privileges and shared responsibilities. Next slide.
And in addressing the inequitable impact on these marginalized communities, like Sadie mentioned, we can do it on the individual, team, and organizational levels. For the individual, I think it's super important to understand that we can't necessarily control patient actions, but there should be no tolerance for workforce racism, homophobia, or anything of the like. And in addressing that, I think having dedicated counselors as a safe place for anyone to go talk to, let them know about their issues, just be able to vent, and then those people can track those patterns and identify areas where, hey, there might be a lot of people doing this and we can address this, and that can trickle up to the organizational level. There's also many reporting systems in every hospital, and if people are brave enough to not submit anonymously, those people should be updated on outcomes and changes that were made based on their reports. And I think that will make everyone accountable for enacting change in those systems. As for team belonging, I think having monthly meetings, I know the strain of COVID has made it so team huddles don't happen as often, but having monthly meetings without strict agendas or checklists with the whole team, including the aides, the environmental services, and administration. And there should be different leaders at every team meeting so that not one voice is triumphing over everyone else's. And every member should be heard and respected. One opinion should not be the say all be all. And strengths like Jessie, where she is making personal relationships with her patients, should be honored, and that should not be a punishment. And moving to the organizational level, supporting house staff and giving them incentives to stay and not go to other hospitals that will decrease turnover and strain on this healthcare community. And if admin can build genuine relationships between themselves and their employees, I think the sense of social belonging will increase dramatically, increasing salaries and promoting career growth for people like Jonas and Sarah and Jessie will allow them to stay at their job, but also feel like people are listening to them and their calls for action are being heard. And then providing childcare. There are so many single parents that have had to choose a job for their kids, and that is not the way that it should be. So we should have some sort of option for them. And then just supporting your employees with support groups, meals, coffee, just small things to show employee appreciation will allow these healthcare workers to continue working in this very difficult environment. And the next slide.
So some implementation steps that are necessary to support radical belonging and make the changes mentioned are determining and setting goals, determining who will take on what roles and what responsibilities, delegating work between members of the team, and providing feedback and assessing outcomes throughout the implementation process. Next slide. And so some short-term actions that can help with these implementation steps is simply acknowledging the disparities and the prejudice that is occurring with other staff members and patients, implementing a feedback form like has been previously mentioned so that we can start determining what the specific problems are, and then also holding a meeting with staff and hospital administration to start the discussion about these problems and set those goals for how we would like to improve, and then also starting to come up with some longer term action steps and potential solutions for those goals. In terms of long-term actions, providing trainings for all staff and administration about equitable treatment of patients and employees, trauma-informed care, and coping strategies are all ways to increase the longevity of the effects of the actions that we are planning to take. And then also having recurring meetings between administration and staff to discuss longer-term policy change is necessary to ensure that this is not just a one-off conversation, but that our goals are being met. And then also progress checks are necessary to kind of assess if there is a change in the workplace culture and if the feelings of those being affected are improving and if the trainings and things like that are helping. In terms of the interprofessional team supporting the implementation process, the interprofessional team is necessary to ensure that all voices are being heard and opinions are being incorporated into the goals, as they will all have various experiences and be able to talk to those experiences. So it's necessary to include all of the members of the team in these discussions to ensure that we're not getting a one-sided view of the experience at the hospital, and to ensure that we're incorporating the opinions of all those that work there.
So a couple different ways we can measure the progress checks that were just discussed. A few direct ways would be surveying employee retention, meaning based on the amount of employees you have, people who are staying because they feel like they're welcome in that environment. They feel like they're working well with the people around them, and they're not wanting to leave because of a dysfunction in their work environment. You can also measure that with employee satisfaction based on how fulfilled they feel working there. And then you can also measure how well these plans are working in a couple indirect ways, such as patient satisfaction of care surveys. Seeing how well a patient feels like they were taken care of can reflect on how well the healthcare team is working together. And you can also look at this through the same lens through diagnosis-specific outcomes. And then, like I just mentioned, each of these measures shows a different way that the interprofessional healthcare team is working as a unit. And then employers can also use these different metrics, the employee retention, satisfaction, the patient care outcomes, to determine where there is kind of like a disconnect or a disparity or inequality within their organization. They can work to correct that error. Next slide.
Okay, part of this is cut off.
There it is.
Oh, perfect. Okay, great. Okay, so to kind of bring it full circle, I just wanted to talk about the scalability of our ideas and implementing them in other healthcare organizations, specifically in the St. Louis region. So to give a little background, during COVID, the hospitals here in St. Louis were making significantly decreased revenues, but a recent finance report came out that the revenues were all higher than before the pandemic. So Mercy made 6.5 billion, BJC made 5.7 billion, and 5.7 at SSM as well. So now we know that it's not really a money issue anymore. There's plenty of money, and that needs to be invested back into the healthcare staff, which will be a large benefit to the turnover rates and retention. So a California-based union, National Nurses United, which represents nurses at St. Louis University Hospital, are now urging hospitals to reinvest dollars into offsetting staffing shortages. And so some ways that we came up with to combat turnover and promote retention include salary increases and sign-on bonuses, which will obviously increase staffing among all healthcare workers. and then offering tangible benefits, so PTO, and actually allowing them to use it. And then autonomy in the workplace. So this includes focusing more on patient care and less on paperwork and administrative tasks that really turn off healthcare workers and can be a major burden and take away from patient care as well. And then flexible scheduling and self-scheduling options. And then utilizing data analytics to identify surges in demand will help identify when we need more healthcare workers and when we need to be scheduling them more to create more of a balance. And then encouraging professional development. So utilizing mentor programs, continuing education, and encouraging certifications, because certifications have proven to increase job satisfaction and patient respect in all of these different ways. Another way is protecting clinician well-being. So providing resources on burnout prevention. I know I've seen like micro programs that you take with hiring to decrease burnout, and then mental health resources as well. And then also employee-led initiatives boost engagement and job satisfaction. So some that I saw included providing like a meditation room, or providing healthy snacks for workers in the break rooms. I know the floor that I'm actually working on right now, they have like a massage chair in the back for any healthcare workers that want to use it. And obviously it doesn't get utilized that much with how busy everyone is, but it's just a nice way to kind of give that support to your staff, and if they need to take a little break, that kind of thing. And then addressing social barriers to work, fostering an environment of understanding and use special consideration. So some of these could include, especially with COVID, a lot of healthcare workers are living with high-risk relatives, and just being there for your employees and having understanding and taking into consideration those things are really important and will mean a lot to your staff. And then beyond just these ways and improving retention, all of these methods will also create an environment that is conducive for learning and clinicals. So I know with me, I've seen firsthand how the short staffing has impacted clinicals for, you name it, pre-med students, PA, nursing, OT, PT, everyone, because your staff is less and you can't find preceptors and those people to train you, which is obviously negatively impacting the future generation of healthcare workers that we desperately need right now. So these methods will not only combat turnover and promote retention, but it'll help us foster that next group of healthcare workers. And once we can adequately staff, it'll positively impact retention, job satisfaction, education, and patient care outcomes.
So one thing that I learned about teamwork from this case is that in order to cultivate a sense of belonging in the team, you really have to consider where your team members are coming from in terms of perspectives, cultures, and backgrounds, and a variety of other things.
Something I took away from this is that each health professional within the interdisciplinary can complement each other better, which leads to better patient treatment and outcomes.
And this isn't something that's going to happen overnight or ever be finally concluded. Belonging is a lifelong goal that we need to strive for. It's going to require effort and commitment from everyone as part of the healthcare team, but it is something that can be worked for. Okay, there's our references.